Welcome, Dr. Adini.
Thank you very much. It's a pleasure to be here.
Dr. Bruria Adini is the head of the Emergency and Disaster Management program at Taos Schools of Public Health, Sackler Faculty of Medicine, and a member of Taos Center for Combating Pandemics. Tell me, why disaster and emergency management program?
9/11, in regards or concerning disasters and crises, was certainly a turning point. It was a period of time. I remember for myself when I saw it, I was in the Ministry of Health then at the time it happened. And I remember we all opened the television and we saw what happened. I remember that my first thought was, I was here when history changed. And so this is something that really changed the consciousness or the awareness of many. But the truth is that disasters, in the past, we thought that there's routine and there's crisis or disasters, and they happened, very infrequently. And when they happened, it's for a short time, and then we go back to the routine. But that's not the case anymore. If we look to the climate change, if we look at human-made events and so on, there is actually a combination of routine life and emergencies. And we now have even a term, a concept that we say the emergency routine. Because you have emergencies because of accidents, you have it because of nature that makes us cope with different types of events. And so it's all meshed together. And if we want to make sure that our societies are resilient and safe and are able to function, we need to be professional in disaster preparedness, in disaster management, and making sure that we can help the societies withstand whatever we have to deal with.
It's like life disaster, not balance, but integration. It's like here in Israel, we are so used to it.
Exactly. It's integrated together. Exactly.
So how would you see the disaster and management in 5 to 10 years from now? How do you proceed that?
I think one of the most important elements that we understand now is that the actual first responders is the population. They're the ones that have, first of all, the availability, the access, the willingness, and the resources to be there immediately when something happens. So I think we are realizing their role more and more crucially and understand their power and how we can, as professionals, empower them even more. And so it's going to be, when I spoke before about integration of different types of emergencies and routine, it will be also an integrations of formal and professional responders and authorities with the informal societies and the person in the street.
For you, what do you think are the character traits and skills that are really important in your job? Like, for example, is having someone who is good in problem solving and critical thinking important?
Well, having the ability to analyze and understand the situation and translate what is happening into what are the needs and what are the resources, that's certainly crucial. I think another element in crisis, our instinct says, let's run away. As disaster management, we have to run to the place, to the disaster. So first of all, you have to be able to maintain your tranquility, your ability to assess the situation and understand its implication without actually allowing the chaotic characteristics, which are the main characteristics of any type of adversity, allow it to impact.
What about an example, maybe?
We just had, a few days ago, a terror attack in Tel Aviv. Okay, I think everyone that saw the picture showed what they could see. Many people in the streets, standing very close to each other, but nobody knew if the terrorist is still there, if he ran away, if there's a danger, and so on. It seemed to everyone that was watching as if the police did not know what they're doing, they did not close the scene, and so on. That's not actually true. They did close the scene, but they closed at a certain point from the bar and so on. But Dizengoff is a long street, okay? Some of the journalists were actually, what they were showing is 20, 30 buildings from there. So you suddenly see two people on the roof. Are they terrorists? I think it's a miracle that they weren't shot, because they were saying, wow, there are these figures on the roof. They're in black. It's dark. So many people were pointing their guns and so on.
I know.
They could have been shot.
Yeah.
What disaster managers have to do is, first of all, see, what do I know right now? Right now, we know where the scene occurred in one of the bars. We know that the terrorist is still in an unknown location. We know that there are many people that we want, first of all, to make sure that they're safe. We want to make sure other people don't come just out of curiosity. We want to make sure that the first responders have available routes to come and help. One of the main lessons that we have learned from this specific event is the need to train the journalist. Okay? The journalists have an important job. Okay? They bring the information, and all of us want and need this information. And we actually are basing our perception of what is happening and our decision to fight, to flight, what to do on that information. They filmed elements that should not have been filmed. And I'm not only talking about exposing, the resources of the special units and so on, but I'm saying, for example, the bodies, again and again, this is something that we know harms the resilience of the population.
What would be, let's say, 3 tips like that you could consider that to share with the population in such a case happens?
Try to get the information from formal sources, because there are so many rumors, and the social media goes into work immediately, and actually everyone that films becomes a journalist and so on. Try to help all those that are immediately around you. Look around. What happened was some started running, and they were running over each other. They were actually, making the situation even worse. So make yourself a resource and not accentuating the problem. And the third is, you're in the place where you can give the crucial information. You're part of building the situation awareness. So all of us have phones. Email the what you see, exactly what you see. This helps to build the understanding of what is happening, where it is happening, and so on, and allows the first responders to actually look upon you as a very important resource, each one of us. I have to tell you something about disasters. And it's the only sure thing that I can say about disaster. And that is that one event will never be the same as the previous event.
Yeah.
So in disasters, it's almost, from event to event in regular life, there is like we learn from it, and we implement what we have learned. This is all about AI and machine learning.
Yeah.
The machine learns from the experience. In disasters, it always differs. So it's not that we can have a protocol that will tell you exactly what to do in the next one, but we do have principles.
I love people who pursue their passion, like with a life full of meaning. That's what life is all about. And I'm thinking, like, what gives you the most satisfaction in your job?
When things are always evolving, you always learn something new, you always do something new. That's something that for me is very challenging and makes it interesting all the time. And that is what I find in disaster preparedness and disaster management. We learn all the time, every day, from the people, from the occurrences, from the infrastructure, and so on. And so it's always, always changing and evolving, and it's always exciting.
Yeah, life is a challenge.
Yeah, that's very true.
Yeah. I read your latest article about COVID-19 and how it affected the Israeli population. So maybe there's something you wish to share about, like, the effects of such event on the mental health, and maybe, like, now I see us like as the post-COVID, perhaps. And we all talked, as you mentioned before, about climate change and like the war in Ukraine, and there are so many disasters around us that, that just appear and again and again.
Well, I think all of the disasters that you said, and especially COVID, that is a prolonged adversity, they've all taught us several things. One of the things is, and I said it before, I think, don't just make assumptions. Don't just look at your instincts to make sure that you act appropriately. What we've learned is that you need the evidence. You need to understand what actually, for example, what concerns the public. We thought I think that was certainly the authorities, the government, thought that what frightens or concerns the public during COVID is a virus. I can be ill, maybe some of my loved ones may contract the COVID and God forbid, die, and so on. But when we researched throughout the COVID, in the past 2 years, and we did it almost every 2 or 3 months, to see what actually the population is concerned about in Israel, that's far from the truth. What concerned them the most was the political instability. We had several elections. That was of the highest concern. The second concern was the economical one. Will I have a job? Will my employment be stable? And only the third and very far lower was the health concern. If you don't address the concern of the public, it won't work. If you don't, for example, understand that what concerns the mother or the father is that they will not have a paycheck at the end of the month and not the virus, they will go to work despite the fact that you ask them to stay at home. We kept saying that the risk population are the elderly, but we saw that the level of resilience of the those that are 61 and older is much higher than the one that are much younger, 31 to 40 years of age. Now, why? Because they were afraid that they will not have a job, and they didn't know what was happening with the education of their children because the schools did not function, only distance learning and so on. So they're the population that we have to be concerned with and provide a response.
This was in regards of the COVID-19. What about like the climate change, for example?
In the last measurement that we took, that was only 3 months ago in January 2022, we gave a list of potential risks, including the political and the violence within the Israeli society and the health risk and so on. What we found, the highest risk among both the Arab population and the Jewish population was the violence in the Israeli society. The political instability was the second, but the third was the climate change.
Wow.
The health was the seventh.
Do you have studies also that measure the level of anxiety?
We measured anxiety and depression
yeah.
and depression over the COVID. By October 2020, 1 out of 5 of the Israeli population displayed high symptoms of depression, and about 33% showed very high anxiety, which is far higher than what we saw in the pre-COVID time. So when the country, for example, brings vaccinations, or when the country tells us, okay, there is a danger for missile attacks and so on, but we have Iron Dome, and we have your best interests in our planning and so on, that makes we see a very definite rise in the societal and the community resilience, and we support each other, and that makes us stronger.
People were so afraid, to meet other people and to get infected,
The 3 lockdowns, I'm not talking about the first lockdown. Nobody knew, it was a new emerging disease everywhere in the world. Lockdowns, the first lockdown was taken as a measure to allow us to protect our healthcare systems and make sure they're not, overflowed with patients. But after that, the lockdowns had a very severe impact on the population, and you can see what happened in the last 2 waves. No lockdowns were initiated. People know how to. There's the wisdom of the crowd. They understand that they have to maintain the distance. But for example, we can meet outside. We can pray together outside, which is a very special and important norm to some of the population. So we adapt the public health measures with the needs and the expectations of the public, and thus we can lower the level of anxiety and depression while maintaining the safety and allowing people to go on with their life, to continue to work and so on.
In a lifetime, you experience so many crises, so it's like, is it a crisis? It's just life. We get used to it. Like there is a generation that is born into all of this.
It's true what you're saying, that even during adversities, if there are prolonged periods, we get you. It becomes some sort of routine. For example, our interest in hearing news about what is happening with the Ukrainian population. Okay, at first it was the first thing that we saw in the news. We had, extensive coverage. It was the first thing, and took most of the time of the news. Now, if at all, it comes at the end of the news and so on. People get used to it, if we can call it that. This is something that we have to make sure that it doesn't happen, and make sure that the interest continues in order for each of us to contribute towards the safety and the well-being of everyone on this planet. This is a solidarity that is, in my opinion, the responsibility of each one of us.
Also, in your work, you mentioned that there are 3 types of resilience: the personal, the communal, and the national. How to define resilience?
Resilience has to do with everything in life. But when you say, and correctly say, that compliance, for example, is dependent on trust, it's true, but not only. This again brings me to the need to base everything on evidence. For example, when we asked during COVID the population, what will enhance your compliance? The first thing is, I want to make sure that my loved one will be safe. The lowest element that they said will impact their decision was to have a fine because they didn't comply and so on. But if the message was, you want to protect your mother, your grandmother, this is what you need to do.
What makes a person more resilient than other? And then also how to build such traits to become more resilient.
What we know for certainty that helps to build the resilience is a combination of support systems. It can be in the family, it can be among friends, it can certainly be the societal organizations and the authorities and so on. So support system is very, very, very important. A second element of resilience, as you said, is the cohesiveness, to make sure that we can actually understand, get the data, get some guidance, get the ability to approach, whether it's someone formal or someone informal in the community. All of these elements, if we feel that we're together, they build the resilience. We saw that one of the most important elements is the solidarity among others, and it's actually intertwined in most of us. We see during any type of emergency, people help each other. That's the instinctive inclination. So we have to build on that. The public is rational. They make the decisions based on what they see and what they hear and what they know. And there's the power of the group, the wisdom of the crowd, which serves them well. But what we saw, that there is a certain percentage of the population that they have a very low resilience, and they will have this low resilience in different types of adversities unless we give them the support.
So, some say that the next pandemic will be a mental health pandemic. What do you have to say in regards, and maybe how to avoid or minimize?
These periods of 2 years of the COVID-19 certainly took its toll. And many more, for example, children, after the 2 years of not being able to go to school, we see phenomena such as higher levels of obesity. We have people without the abilities or the capacity to maintain friendships. We have much higher addictions to screens and so on. These are all elements of mental health, and we have to be there and try to work on that. And this is, I don't think it's something that we can say in the future. I think it's today. It's already now.
Yeah, exactly.
And this is, for example, one of the reasons which I thought that it was such a wise decision not to implement another lockdown, okay? Because that is a very negative element on the youth and on small children and so on. If we invest in preparedness, it's much more effective than responding when it happens. There are studies that actually showed the data that for every dollar that you invest before any adversity, you'll save $7 during an adversity. Because if you don't do the preparation in time, the cost will be very, very, very high.
Any government you're familiar that actually does it, prepares?
Japan invests, many, Chile, countries that had to deal with
Natural, maybe
with
disasters.
natural events or other types of adversities. Usually you find them investing more. I have to say that Israel also invests some amount, but it's far from what is needed. And not enough authorities think in this way that if I invest now, it will save me the cost later. Because what happens that many governments, especially in democratic governance systems, they think per their own candidacy period.
Exactly. Could you share like an example of a moral dilemma from your field?
There's always moral dilemmas in disasters. I'll tell you that the simplest one, when you deploy a field hospital to the Ukrainian, any cities that is now have so many casualties and so on. Who do you let in and who do you not? This is a terrible moral decision because you understand the consequence of your decision, the one that you will not let in because you think you will need to invest too many resources, and that will mean that you will not be able to allow for others to come in. And then you have to make the hard decision, the inclusion criteria of who you will treat and who you will not. This is very hard personally because you look the person in the eye and you said, well, I'm sorry, we cannot help you. We do a lot of ethical, debriefings and training and so on. But here again, the most important element is the support. How does it come into effect? For example, when there was the deployment of the field hospital, the Israeli field hospital in Haiti or in other places, the decision of the triage of the deciding who will come in and who will not is made by a team and not just one person. And every evening at the end of the shift, there's a debriefing so we can talk about it, okay? When they get back, they're debriefing. The support of the group is crucial so that it's not me as an individual saying, well, I'm becoming a god and deciding who will live and who will not. We have to be very much aware, not only of those that are very vocal and they come and seek help on their own volitions. We also have to look to see if there's changes in the behavior of others. And this is, again, I'm bringing it back to the responsibility of the individual, the family or the friends, to see that there's a change in behavior. There's loss of weight, less communicative, or loss of appetite and so on. We have to be very vigilant so that we can understand that something is happening and try to bring the needed help.
What about human rights? I would say women and kids. Like, it's
human rights is something that is very much discussed concerning any type of adversity, because it always, again, has to be a balance between the public health and the human rights of the individual. Putting me in lockdown is, I'm doing it to save others, but it may make me lose my income. Okay? Or making me put a mask, or other measure. You know what? I'll take it another element. The vaccinations. There was a big debate. Should we make the vaccinations against COVID mandatory? I mean, we believe it's a very important public health measure, but we don't really know over time what the vaccine may do. Okay, we are not there because simply not enough time has gone by.
It's like the right to information, but then, as you said before, nobody knows. It's
the information is not known as yet.
It's so scary, like when you go through.
We could see it, you can see it in the data, that the level of adherence with vaccinating children is much less than what it is with the adults. We are, accepting our own responsibility to be vaccinated and so on. But my small daughter, I still don't know what it will, do over time, the fertility and so on. So many parents were afraid. And that's, again, a balance. When is it something that we want to ensure it happening? And when is it crossing the line between the public and the human rights?
If there was one piece of advice you could give the young you, what would it be?
I would do the same thing. I would take the same route. I love, it's terrible to say I love doing what I do
Yeah.
because it has to do with disasters. But I think it has to do with disasters in order to make the world a better place and a safer place and so on. But one advice that I would do, and I certainly do it with my daughters, is get to know the international community as early as possible. We should not live in sort of separate societies.
Yeah.
I really believe that the joining together of different cultures and different norms and different languages.
Yeah.
I would learn Arabic at an early stage. I would want, on top of English, French and Spanish and so on, Russian maybe, or Ukrainian. I think this meshing together in international cohorts and international gatherings, that is something I would like to start at a very early age.
Your children, so like, what do you foresee or think that the challenge that they will be facing in the next generations?
First of all, it's a completely different generation. They are much more aware than my generation of their responsibility for others. It's funny, and I see it among many young people. They want to volunteer much more.
Yeah.
I don't remember it to such extent in my generation. They want to meet other people and have other experiences. We see Israeli youth. The first thing they do after the military service, they go to long journeys in the world. I think that's a beautiful trait.
Do you think there are like cycles of different generations that form different identities, like the pioneers, the settlers, those who like now enjoy life, and then those who now have to fix and again, or something as such?
Well, they keep, there's a saying like, we built you a good world, and now you're not investing enough in trying to sustain it and so on. I think completely the opposite.
Yeah.
I think the legacy that we're giving the next generation is a horrific one. Certainly these days, when I look what happened in Ukraine, what is happening in Ethiopia, what is happening in many Asian and African countries, and the world is attentive only to a very short time span and not doing enough.
How to fix that? Like the short span of attention. I mean, that's at the system level, because this is so challenging.
If I knew the answer to that, I think the world would probably be a better place because others would know it too.
You just talked about forming networks of human consent and like for disaster and emergency management.
But we're not doing
global
enough.
Community.
We're not doing enough.
All the organizations that work together, like how is it?
One of the elements, I think one aspect, one component, a very important component of the solution is networking wisely. What do I mean by that? We can see, in Ukraine, for example, we'll take it for example, there are many, non-governmental organizations and countries that send all kinds of delegations and so on. But one of the elements that sometimes is missing is the coordination.
Yeah.
Okay, we don't want them all in one place. We don't want them all just giving attention to a specific portion of the population. We need them spread around. We need to coordinate between them so that, for example, one will be able to give the immediate response, and then the other will be able to give the more long-term. The first will take care of the immediate life-saving needs, but then the psychosocial needs will be also getting attention and so on, because we want a quality of life. We don't want you to slave life. That's first. You have to save the lives, but then you want them also to be able to evolve and grow and empower them and allow them to live a meaningful life and so on. We can only do it if we coordinate it wisely.
This is something that can be taught in universities and also have various universities also build up that network that you just mentioned.
Of course. I think the integration of the academia with the decision makers and the policy makers, that's the real solution. Because we bring the data, we give them the answers against the assumptions that they sometimes make that may not be relevant, and they have the power to implement it and to actually, take the elements and do it in large scale. So this collaborations between the scientific realm and the policy making realm, that's the real answer to making things much more appropriate and the optimal utilizations of all the resources.
Do you have, like, as you were speaking, like, I was thinking, like, do you have stories of your students that you are proud of, like, that you saw them, like,
There are so many.
I'm sure, but like, I mean,
I
yeah.
want to tell you a story. Last year, there was a student that enrolled to a different program in the university. And after a month, he contacted me and he said, I really want to transfer to your program. I wanted to register to your program when I made the registration, but your program was more expensive and I didn't have the funding. But this is such a dream of mine that my father now allowed. He's a student from Italy that came to our international program. And he said, my father now consented because he saw my dream. Will you accept me? And I said, listen, we're already 4 weeks into the program. We allow transfer only in the first 2 weeks. But something in him, his passion, his excitement, I said, you know what? I'll accept you. He came to our program, and we have an internship program as part of the academic program. And in the internship, he volunteered in Israel, which is one of the non-governmental organizations that work in different places in the world. He was one of the best students in the program, and he was a wonderful volunteer and intern in Israel. When he completed the program, he went as a volunteer to Swatini through Israel to help them with the vaccinations of COVID. They then accepted him into Israel as an employee. Since then, he's been in Haiti. He is now in Ukraine. He is exactly the role model that you see someone with passion that wants to do good, that wants to give himself. He didn't even go to visit his parents. In Italy, he says one thing after the other led to another adversity, and he is out there making a difference on people that are less lucky, that are afflicted with different type of emergencies. And he's now been joined this year because of everything that is happening. We have students that deployed throughout during the learning period. They were 2 weeks helping after the tornadoes in Kentucky. 2 others are now being deployed to countries bordering Ukraine, to Poland and to Moldova with the different NGOs. They're making a difference. So they came here to study, but we also allow them to make a difference and make an impact in the field with the people that unfortunately are suffering in their everyday lives.
The number of students that register to your program, I guess it's rising maybe nowadays. It's like,
yes, since the COVID, we see a huge interest. There was always interest, but since the awareness rose of how much adversities impact our lives, everyone's lives, all the time. And we see it in the numbers of interested people, and it makes me very happy. Although we can only accept, a small number, but still the interest of more and more people wanting to make a difference, wanting to impact, wanting to help make our world a safer place is something of great gratification.
What's the meaning of life?
Making the most of every day.
Wow.
Being with people and enjoying it as much as possible. For me, people, especially loved ones and so on, but population at large, that's the meaning of life.
What are you ready to struggle for in that sense?
My children. Struggle is first and foremost the family, the friends, the community, and so on, the country. I think we're struggling here for many, many years, all of us.
Here in Tao International, we came up with the term Taoism, which refers to your own unique personal experience. What Taoism is for you?
For me, Taoism is bringing different people together to the same experience, to the same gatherings, to the classroom. We have the Israeli cohort, we have the international cohort. They come from different societies, different cultures, different religions, different genders, completely different experiences in both the undergraduate studies and in life general, this is Taoism for me. Meshing them together, learning from each other, having everyone contribute to the learning experience and to the empowerment of us all. That's Taoism for me.
Amazing. Thank you so much, Dr. Adini. You've been an inspiration even to me. I much enjoyed this conversation. Thanks for listening to this conversation with Dr. Bruria Adini.
Thank you for the opportunity, and may our world be safer and more resilient.